Hey everybody, welcome to Pick Dr. Osborne's Brain. Hope you're having a fantastic Monday. We've got a great topic for you. We're going to be talking about hormone triggers for leaky gut. And in this video, we're going to be diving into specifically which medications that you may be taking, your doctor may have prescribed, that you might not even know could be contributing to leaky gut and exacerbating a pre-existing problem or increasing the risk for developing autoimmune disease, etc. So stay with me through the entire segment as we dive into this. And as always, make sure you let me know where you're tuning in from in the world. We'd like to know how far our audience is reaching. And hashtag, hit me up with some hashtags, save 100 million lives there in the comments section, if you would, please. That helps us get this message out and spread to more people. And if you know somebody who is struggling, hormone problems, and can benefit from this, make sure you share it. Don't be stingy and make sure you share. We can help more people if we share this information together. So tonight we're going to be talking about hormones and leaky gut, which is interesting because some of the top prescribed medications in the world are actually hormone therapies for females. Now, you think about this, leaky gut is the precursor, right? Leaky gut is the precursor for autoimmune disease, meaning leaky gut oftentimes has to be present in order for autoimmune disease to develop. And that's why this is so critical, because so many of you are taking hormones to treat autoimmune diseases. So if the hormones can actually cause leaky gut, the ones that you're taking, and leaky gut can contribute to autoimmune disease, you can see how this can kind of become a vicious cycle. So if we look at one of the top hormones prescribed, we've got levothyroxine. Now, make sure I spell that right for you. So levothyroxine is a type of T4 preparation given to women and men alike. T4, which is inactive thyroid hormone, but it is the medication given to people that have low thyroid function, right? Hashimoto's is one of the forms of autoimmune disease, Hashimoto's disease, of low thyroid function. Now, one of the biggest problems I see in clinic, people come to me from all over the world with this issue that they're on levothyroxine, their other doctors have prescribed them levothyroxine to treat their Hashimoto's or low thyroid, but simultaneously, these women have a gluten problem. Now, gluten sensitivity, we've talked about a number of times, is one of those things that can contribute to thyroid problems. So gluten, we know there's a lot of research, there's over 300 research studies that show the connection between gluten sensitivity and low thyroid. Is particularly, though, there's research that shows that gluten sensitivity can actually cause Hashimoto's disease. Now, the problem with levothyroxine is that it has, inside of it, it has corn. Now, many of you may be saying, well, corn is gluten-free, right, Dr. Osborne? No, there's a type of gluten in corn called xane. And this type of gluten, this xane gluten, has been shown in a number of research studies to be more detrimental or more inflammatory than wheat gluten. And if this is the first time you're hearing it, let that sink in for a minute. Corn gluten, research studies show, can be more detrimental than wheat gluten for people with gluten sensitivity issues. So again, going back to this, gluten sensitivity can cause low thyroid. Many people that have low thyroid are given levothyroxine, which contains corn, which is more detrimental than wheat gluten. If you're gluten sensitive, it's going to kind of feed into your hypothyroidism. So if you are a female taking, I say female because the vast majority of people on levothyroxine are females. So if you're a female or a male and you're taking levothyroxine for your low thyroid and you also are gluten sensitive, know that you're getting a source of gluten, albeit it is not a source of gliadin or wheat, barley, and rye gluten, but corn gluten that has been shown in science to be more detrimental than wheat gluten, contributing to gluten sensitivity. Now, why is that important to understand? Is because one of the primary causes of leaky gut is gluten sensitivity, and one of the primary drivers of autoimmune thyroid is leaky gut. So you see that pattern, you see that correlation, very important to understand it. Again, so many of you taking Leave It to Roxanne. I've just this week already, and it's only Monday, I've talked to 2 different people who were gluten sensitive, whose doctors prescribed them Leave It to Roxanne. And so, part of that conversation was follow up with that doctor and ask that doctor to write you a compounded version. So those of you who are out there saying, well, what the heck do I do? Get with your doctor, ask them to write a compounded version, meaning they can still prescribe you levothyroxine or T4, but they can do so without the corn filler or any of the grain-based fillers. Now, again, if this is brand new information to you, the other thing I would encourage you to do, aside from getting that, you're asking your doctor about the compounded version, is go read No Grain, No Pain. If you haven't read that yet, you need to read it, because if you think you're following a gluten-free diet, if you've been told somewhere along the line that you have a problem with gluten and you think you're following a gluten-free diet, it's very possible what you're actually following is a traditional gluten-free diet and not a true gluten-free diet. And if you don't know what that means, you've got a world of hurt coming your way, because research studies have shown that up to 92% of people following a traditional gluten-free diet fail to actually overcome the inflammation that they're experiencing for the reason they went gluten-free in the first place. So again, No Grain, No Pain is what I would recommend that you read. It's a nice weekend read. It doesn't take that long to read it, but it can enlighten you. And one of the things it's going to enlighten you about is corn gluten being more detrimental than wheat gluten. For those with gluten sensitivity, again, is a trigger for autoimmune disease. And what are we talking about here? We're talking tonight about leaky gut, right? Hormones that cause leaky gut. Okay, and this is one of them. It's not the T4 that causes the leaky gut so much as it is the filler ingredient, right? The gluten issue that drives the leaky gut, that then subsequently drives the autoimmune disease. And again, if you've got autoimmune thyroid disease, you're going to be spinning your wheels. So that's number one, thyroid hormone. If it is a thyroid version of thyroid hormone that has grain-based derivatives or corn-based derivatives with gluten in them. Another big one I want to talk about tonight, because many of you are taking estrogen, particularly for most, when they go on estrogen, it's a form of estrogen called estradiol. Now, this is found in, so if you're a woman and you're going through menopause and your doctor's prescribed you what they're calling bioidentical hormones, those are estradiol. Now, if you're not on bioidentical and you're just on the straight estradiol, kind of the general version, so to speak, the difference is that bioidentical hormones are actually much safer. They more match your hormones naturally than like drugs like Premarin, which are horse urine derived estradiol, and these are so the other version there, the non-bioidentical version, is associated with a lot more side effects. But that being said, it doesn't matter whether you're taking bioidentical or non-bioidentical estradiol. If you're taking estradiol, it applies to you. Now, the other that we see women with estradiol is when we're trying to either prevent a pregnancy, so BCP, birth control pill, right? Or we're trying to normalize a cycle. And so a lot of times doctors will just say, you have an abnormal or a painful cycle. They'll prescribe you a form of estrogen therapy for that. So we'll see, again, these forms of estrogen therapy oftentimes given in menopause for hot flashes or for other perimenopausal symptoms, hot flashes, trouble sleeping, irritability, agitation, severe mood swings, emotional instability. And then we'll see this prescribed in women who are trying to prevent pregnancy, but also to normalize their cycle. So estradiol. Now I'm going to put up a research study. So I want to show you, it's actually the first one on estrogen and leaky gut here. So what we're looking at in this research study, and it's just published a couple of years ago, so it's not a super old study, and there have been other studies that have confirmed this very thing I'm going to talk to you about. But what the researchers in this study found is that estradiol reduced the production of the protein. The name of that protein is zonulin, so it reduced zonulin expression. Okay, zonulin is a protein inside your gut. Okay, between the cells that line your gut, but it's what prevents a leaky gut from happening. So think of it as these little anchor proteins. So if your gut cells kind of look like this, where they're stacked like columns, okay, and then they have their little cilia-based and microcilia for surface area of absorption. So again, if this is the basal membrane of those cells, and then below that basal membrane, this is where, if this is your gut lining. So again, let me just make this more comprehensive for you. Okay, so this is the lumen, or this is, the intestine, right? The small intestine. The lumen, meaning this is the tube of the small intestine. So food is coming down. If your mouth is up there, food's coming down and it's coming through the tube. And then on either side of the basal membrane, you have the bloodstream, right? So then you have your bloodstream, and this goes to your liver. It goes to what's called your portal circulation. But what happens is food comes through, and you have these proteins that kind of anchor the cells together. If you don't have these proteins that anchor the cells together, what ends up happening is you get cells that drift apart. And so then when that food or that food protein or that bacteria, whatever it is, it comes through, this is a leaky gut, right? This is basically what leaky gut looks like on the scale. So these cells, they separate or they drift apart, you get leaky gut, and that leaky gut allows things in your gut to leak into your bloodstream and create systemic inflammation and contribute to autoimmune disease. So zonulin is the protein that creates these anchors. Okay, so that snaps, think of it like a Lego block, the way the little prongs snaps together, right, to keep the block stable together. That's kind of what this zonulin does, is it snaps these cells together so that there's no gap in between them, preventing any type of leaky gut formation. And so what this research is showing is that prescription estrogens reduce the expression of the protein that seals your gut lining. And that's a problem, because that means all of you that are out there potentially taking estrogen for different symptoms could potentially be creating a leaky gut in that process, again, which increases your risk for the development of autoimmune disease. Now, we already know that estrogens, again, more specifically, estrogens will increase your risk for heart disease. We also know it will increase your risk for cancer. So what we're saying here now is that it increases your risk for leaky gut and subsequently autoimmune disease. So again, estradiol, whether you're taking for menopause symptoms, whether you're taking it, some doctors actually also prescribe it to women in menopause for prevention of bone loss, or whether you're taking it for birth control or to normalize your cell cycle or your menstrual cycle. Again, remember that it reduces zonulin expression, creating the potential for a leaky gut scenario. Now, if you look at this research study again, I'm going to have that thrown back up on the screen for you. So you can see here the fact that the expression of zonulin 1 is inhibited by estrogen indicates estrogen may increase gut permeability, and as a consequence of systemic microbial translocation and its associated inflammation. If so, multiple microbial products such as RNA, DNA, peptidoglycan, and flagellin derived from bacteria, viruses, fungi, and other gastrointestinal residents may translocate into the system and cause systemic immune activation. So what does that mean? What does all that fancy talk really mean? It means that when you have a leaky gut, remember, in your gut, you've got trillions of bacteria and viruses, and you've got fungi or your microbiome, which are the different fungus or yeast. They all produce byproducts, right? They all produce metabolic waste products. in some essence, in some research, some of these products are called LPS, lipopolysaccharides, and they penetrate, they translocate into your bloodstream. They get into your bloodstream, they activate your immune system to create an inflammatory response to attack it. See, remember, your gut's not supposed to leak. These chemical toxins, this bacteria, the fungus, like all that's supposed to stay in your gut. I did an interview with Dr. Fasano a couple of years ago, and I liked one of the things he said. If you guys don't know who Dr. Fasano is, he works at Harvard, and he's actually one of the doctors that discovered leaky gut through his research. But he said, what happens with leaky gut, what happens in the gut doesn't stay in the gut. It's not like Vegas. Those were his words. I thought that was somewhat comical. Anyway, bacteria, fungi, and other things, other compounds, so like food antigens, so like food proteins. These things should stay in the gut unless they're properly broken down, and the carbs, the fats, the proteins or amino acids or the simple sugars or the vitamins and minerals are the things that are supposed to, they're little receptors or doorways on the surface of these cells, and they're gated so that things that are supposed to be let in are checked and they're allowed to come in. And so they got, so think of this as the guardian at the gate. If your guardian is on vacation, you get this leaky gut. And so all these guys get to leak through and create systemic inflammation that can occur. And this is what can drive and trigger food protein allergies. So a lot of people say, well, how come I have allergies? I've been eating these things my whole life and didn't feel bad until, a year ago or 5 years ago. It's because with leaky gut, you can become allergic. You can develop what are called acquired allergies, and you can start acquiring more and more allergies because as things leak through your gut barrier into your bloodstream, you're overwhelming the immune system. You're making the immune system hyper-responsive, almost like a soldier who's been at war too long. If that soldier has a post-traumatic stress from being at war too long, and if somebody taps that soldier on the shoulder, the soldier might just turn around and punch him out, even though that's not an appropriate response. He's been so on edge for so long, he's hyper-responsive. And that's what happens to the immune system. It becomes hyper-responsive. And in that hyper-response, we get systemic inflammation. So we don't want those things leaking into the bloodstream. We want those things staying in the gut. Okay? It's kind of like Vegas. Again, what happens in Vegas stays in Vegas. Now, what happens in the gut should stay in the gut. But if you have a leaky gut, it doesn't work that way. It gets into your bloodstream, creating a major, major problem. So again, estrogen. Any of you taking estrogen, you've probably not heard this information before. Nobody's talking about it. But anybody taking estrogen, you understand that you're increasing your risk for leaky gut. Now, I want to show you another study. Let's look at part 2 to this. So what you're looking at here, adverse reactions to food, the female dominance. Is, why do women tend to have food allergies at a higher rates than men? And so there's a couple of different ways to look at this. So we're talking about food allergies, but I also want to come back to autoimmune disease, because autoimmune disease, this is the #1 cause of death, COD, cause of death, in females under 65. Okay, #1 cause of death. Now let that sink in for a minute. Number one cause of death. Major contributor to death, okay? What causes autoimmune disease? Leaky gut. What do females make more of than men? Estrogen, okay? Now, we've already known that there's a huge disparity with autoimmune disease between women and men, meaning that men are less likely to develop autoimmune disease than women, and this is actually one of those reasons why. Okay, that estrogen perpetuates or can contribute to autoimmune disease through the production of leaky gut. Now, I would argue that part of the problem isn't just how much estrogen you make naturally, but you have to understand that many of you eat poorly, and the foods that you eat can actually mimic estrogen too. And so you're making estrogen, but then you're getting exposure to what are called xenoestrogens. So things like chemical estrogens. Where do we find these? We find xenoestrogens predominantly in plastics. Let's throw up an image. I want to show you an image here on the causes of leaky gut. So we've got a nice diagram, and I want you to be able to look at this and kind of take reference from it. So what you're looking at here, these are known causes of leaky gut. And so what I'm going to point out on this particular diagram is on the right-hand side of the diagram, kind of right in the middle there, you'll see plastics. Why? Why do plastics contribute to leaky gut? Plastics contribute to leaky gut because they're a form of xenoestrogen. And so plastics, if you're exposing yourself to lots of plastics or plastic byproducts, drinking out of plastics, eating out of plastics, understand this is one of the triggers for hyperestrogen or estrogen dominance scenario. So plastics can do it. Look down below plastics, you'll see pesticides. Pesticides can also contribute. Well, where do we get pesticides? Non-organic foods. So again, eat organically, don't eat out of plastics if you want to avoid excessive estrogen exposures from xenoestrogen sources so that you don't create an estrogen dominance that increases your risk for the development of autoimmune disease. Because females, look, you already make estrogen, you don't need more from chemical toxins. And so other places you can get xenoestrogens aside from pesticides and plastics they're going to be found heavily in cosmetics. So if you are using cosmetics, you want to try to find brands or varieties that don't contain these chemical xenoestrogens. Again, we don't want you to increase your estrogen dominance burden because estrogen, again, remember, #1 cause of death in females is autoimmune disease under the age of 65, and we know that hyperestrogen or estrogen dominance contributes to autoimmune disease. We know that females are more likely to develop autoimmune disease. We know that estrogen is one of the reasons why, because estrogen can contribute to leaky gut. Now, all that being said, let's put up that study. I had it up a minute ago. It was on, here we go, adverse reactions to the food. So food allergies versus girls versus boys, right? And I wanted to show you that women are more likely to develop food allergies, okay? Food allergies are more common in women, okay? And part of this also has to do with estrogens causing leaky gut, okay? You're a female, this is already an increased risk for you. So again, how can we change that? Well, we can question the need for the medication. We can question what we're putting in our body in terms of estrogen exposure, right? But why do females have more allergies? This is one of the reasons why. Remember I said earlier, when you have a leaky gut, you eat those foods, those food proteins can leak through unchecked. And remember, right behind your gut wall, right behind that lining, you have something called the G.A.L.T. What is G.A.L.T? It's an acronym. It stands for gastro-associated lymphoid tissue. Okay? Think of the G.A.L.T as the tonsils of the gut. What are the tonsils? Tonsils in your throat, right? What are they? They're a large conglomeration of immune tissue. Well, your G.A.L.T is a huge set of tonsils that wraps around your small intestines, and it represents 70 to 80% of the entire immune system. Okay, 70, 80% of your entire immune system is right here in your small intestine. So if you've got a leak and those food proteins are leaking right into this G.A.L.T, what you get is warfare. You get a battle. Those food immune proteins are triggering your immune system, and so the outcome of that is increased likelihood for the development of allergies. Again, why do women have increased allergies over men? Estrogen contributes to an increased risk for leaky gut. You compound that with estrogens in plastics, estrogens in pesticides, estrogens in cosmetics. As you know, estrogens in cosmetics are unique mostly to women because typically your average man is not wearing cosmetics and not being exposed to those things unless he's being exposed from women. So again, let's think about that. How can we reduce our risk? You know, you don't want to go have your ovaries removed so that you don't produce estrogen. And I say that jokingly, but not. I don't know how many of you remember, was it the star Angelina Jolie went and had her breasts removed because she had a gene risk for breast cancer, which in my opinion is an absolutely ludicrous thing to do. You don't want to go have surgery to remove your ovaries because of this. You just want to do things intelligently with your diet and your lifestyle so that your body produces estrogen on its own naturally and healthfully, but you want to reduce your exposure to these other behaviors and to these other chemicals that can increase the risk for developing, an estrogen dominance situation. So there are nutrients associated, right, with estrogen, nutrient deficiencies associated with estrogen dominance as well. For example, magnesium deficiency, zinc deficiency, vitamin B12 deficiency, vitamin B6, vitamin B2 deficiencies can increase the risk for hormone abnormalities, meaning you make it more difficult or more challenging to properly metabolize your estrogen and excrete it if you're deficient in those types of nutrients. So again, B vitamins like B2, B3, B6, B12, and folate, as well as magnesium and zinc, very, very important for the proper metabolism and excretion of estrogen. And so those things, very, very critical, right, to prevent an estrogen dominant scenario as well. This is also why some doctors recommend that women consume vegetables that have DIM, D-I-M. This is a substance that helps to modulate estrogen metabolism as well. So cruciferous vegetables, things like cauliflower, broccoli, which are rich in DIM, can help with this process. So doing your part from a lifestyle perspective becomes very important. Don't go have your ovaries removed in fear of the fact that you're a female and that you're going to have a greater likelihood of developing or an increased risk chance of developing an autoimmune disease, because it's not just the estrogen that does this. What I've drawn out for you is I've tried to simplify it as best as I can so you can understand the concept, but I also want you to understand it also is more complex than just estrogen causing autoimmune disease. Again, we look at what contributes to autoimmune disease. This helps the process, and females have more of this, right? But what are the factors that really trigger autoimmune disease? And I've talked about this a number of times, but remember there's 4 categories of triggers for autoimmune disease. Category number 1 is food, the wrong food, right? The wrong food can trigger, and gluten is the most well-studied. Gluten, dairy, and sugar, probably the top 3 autoimmune-inducing foods. Okay, so that's category number 1 is food. You should, if you're suffering with autoimmunity, you should get with the doctor, make sure they're testing you for food reactivity. Otherwise, you're missing a big chunk, 25% of the reason why that autoimmune disease develops. Number 2 is chemical exposures. Now, I just mentioned xenoestrogens, plastics, pesticides, heavy metals are another family of chemicals people get exposed to. There are lots of dyes and food preservatives that can also act as xenoestrogens and also contribute to and trigger autoimmune disease. So chemical exposure, so minimizing your exposure to chemicals as much as possible. So that's category number 2, and it can also be measured objectively. And if you're struggling with autoimmune disease, you should ask your doctor, have a conversation with your doctor about measuring those things. Trigger number 3 is nutritional deficit, which I mentioned a minute ago. Certain nutrients responsible for helping your body metabolize estrogen and excrete estrogens appropriately. So nutritional deficiency plays a major role as a trigger for autoimmune disease. And then the 4th trigger is microbial imbalance. So going back to what we talked about here, microbes, bacteria, fungi, viruses, things of that nature, imbalances of these things can contribute to and create a leaky gut, autoimmune disease, etc. So those 4 categorical triggers are things that you can do something about. Ladies, you can't do anything about your estrogen other than taking care of your body so that you produce the appropriate amount and not necessarily having the need to take extra estrogen to mask symptoms, because so many of you have probably gone down that road. As a matter of fact, how many of you tuning in tonight have been put on some form of chemical estrogen by your doctor? I'd like you to just chime in, just type in, yes, estrogen. How many of you have actually been placed on prescription estrogen for your symptoms to mitigate or manage your symptoms? So that's what I wanted to cover tonight. I wanted to cover this topic. It's such an important topic, and so many of you, again, being put on estrogen, so many of you having a leaky gut component as a result of that, or having increased risk of autoimmune disease. And again, that number 1 cause of death in females under the age of 65. And so we don't want to lose sight of that. Now, that being said, I'm going to put below this video, we'll put up some links to some of these references that I'm discussing or that I've discussed tonight. So if you want to go read more about this topic, you can do that. Now, in addition, let's take some time out and answer any questions that you guys have. So if you've got hormone-related questions, love to start tapping into those questions and getting those answered for you. Okay. Let's see here. Is sparkling water bad for health? Is it good for acid-base balance to improve alkalosis? Look, sparkling water is not something you should drink more than regular water, depending on the source of the sparkling water, because that matters too. But, you know, sparkling water is, a lot of people, it can irritate the gastric lining. And if you've already got irritation in your gastric lining, sparkling water can just kind of keep that exacerbated, or keep it and make it problematic. Let's see here. Is it true excess fat is bad for leaky gut? No. I don't know where that's coming from, but excess fat, first of all, we have to define what that really means. You know, your definition of what you think might be excessive fat might not be my definition. I mean, fat consumption, a lot of people are on keto diets or high fat diets and low carb diets, and that's not necessarily something that's going to create a leaky gut. Some people thrive on a higher fat diet. I mean, the Alaskan Eskimo, the Inuit people are perfect examples of individuals who thrive on a very, very high fat diet. You know, more than 60, 70, 80, even up to 80% of the diet is fat. As far as supplements for lowering cortisol, I wouldn't say a supplement for lowering cortisol, but to support adrenal function, there are a number of different supplements that can do that, a number of different herbals that can kind of at work as what are called adaptogens, so they help kind of modulate and help support natural cortisol formation. But even beyond those, the best thing you can do for cortisol, if you've got too much cortisol, is reduce your carbohydrate intake, because cortisol is driven up by excessive sugar. Cortisol is also driven up by lack of sleep. So I'd say before you start taking supplements for cortisol, do those two things first. And then if those two things fail, come back and ask me, and we can do a deeper dive into some of the different adaptogens, herbs, and other supplements for cortisol. Now, if you're talking about vitamin support for cortisol, my two favorite things are vitamin C and vitamin B5, and your body needs those anyway. So they're not going to be herbals that have a drug-like effect, which, you know, I'm not necessarily against having a drug-like effect with herbs, but I'm against it as a first criteria for trying to improve or trying to make changes. Linda wants to know, is it possible to be weaned off of NP thyroid, or do you have to be on thyroid meds for life? It depends on the person, Linda. I've seen cases where people have been able to get off their thyroid medication, and they've been told just the opposite of that. I'd say there are a couple different scenarios where thyroid medication is probably going to be necessary for the rest of your life, and one is if you've had your thyroid removed or radiated. In those types of situations where you don't have your own, thyroid gland producing your own thyroid hormone, then probably a great idea to continue to follow up with that prescribing doc and monitor your thyroid and stay on that medication. However, if you dialed in your nutrition and figured out why your thyroid wasn't working in the first place, sometimes what happens to women is their medicine becomes too strong. And so when the thyroid medicine becomes too strong, some of the symptoms to look out for with thyroid medicine being too high, right? So we look for heart palpitations. We can see what are perceived to be like hot flashes or temperature flashes. We'll see anxiety and irritability. We'll see trouble sleeping. Sometimes we see tightness in the throat form because you're going too far in the other direction. Sometimes we'll see dry skin and hair loss, which are also symptoms of not enough thyroid. So pay attention predominantly to anxiety, heart palpitations, hot flashes, trouble sleeping, and agitation, increased agitation. If you're doing diet change, or if you're following something like no grain, no pain, and you're getting better, and you're starting to develop these and you're on thyroid medication, the best thing to do is follow up with your doc and talk to them about measuring your thyroid and make sure you're not over thyroid medicating, because I see this happen all the time. Once we start dialing it in, we'll see the TSH start to really drop below 0.5. 0.5 is kind of the bottom number for your TSH, your circulating TSH. And if you change your diet, sometimes what happens when you're on thyroid medication is that TSH will drop below 0.5. I've seen it drop down to 0.01 or 0.4, 0.3, just lower than that 0.5 means your thyroid medication is too strong, that it's time to talk to your doctor about a dose adjustment. But yes, you can get off of it. It is possible. You just have to have the right guidance in order to position yourself to make that transition. And if you don't, I don't recommend doing it on your own. You definitely need to be working with a doctor to do that. Yeah, Case chimes in, nature thyroid or doesn't contain corn or gluten. Insurance usually won't pay for it, but it works well for me. Case, where insurance will cover it for you is if you have gluten sensitivity documented in your records. So, again, if you're on it and insurance isn't covering it and you're gluten sensitive and your doctor's documented that, then insurance will cover it because there's the need. So you might talk with your doc about that too. Let's see, how best to take a filling out of the tooth. It can cause problem if it has lead in it. So not so much lead, but mercury. So the amalgams, the older amalgams, the silver amalgams that contain mercury, if you're going to have one of those removed, those can cause hormonal disruption and hormonal abnormalities and contribute to an increased risk for autoimmune disease. Mercury is a neurotoxin. You really want to get with an environmental dentist. So look that term up, environmental dentist. There's a website you can also visit, IAOMT.org. This website lists out different dentists who are properly trained in the removal of mercury fillings, where they can take them out of you without hurting you. Because when you as a dentist, when you start pulling out mercury, you have to understand it's an EPA biohazard. Mercury has to be handled as if it's a biohazard, and so the reason why is it's very dangerous. So if that dentist is just kind of chipping away at that and pulling it out, and you get exposed and you swallow that mercury and you get systemic exposure, they're not damming you properly or running the right types of vapor fans to protect you from the mercury filling, then they could actually end up hurting you. So it's very important that you get with a qualified dentist who's certified in knowing how to remove mercury amalgams while protecting you in the process. Let's see here. Does storing food in plastic bags or having other plastic things in the house also contribute to leaky gut? It's a great question, Donna. I would say don't store your food in plastic bags if you're going to use any kind of heat around it. So like, for example, plastic will outgas. So it's not a great idea to really store in plastic. One of the first things I would recommend anybody who has plastic storage is get glass Tupperware. It's better. You'll have less plastic leakage or less plastic chemicals kind of leaching into your food. But I don't know that I've come across any research studies that says that storing your food in plastic bags all by itself directly increases estrogen. All we know is that increased exposure to plastic-based compounds as they leach into your food is what happens. But when they leach into your food, generally it's a heat issue. So when you heat things up in plastic or eat food that's heated up on plastic, so that's a big taboo, big no-no. Let's see here. Susan says, is this only when there's estrogen dominance, or if there is enough progesterone to balance out estrogen, is there still a risk? No, there's still a risk. Estrogen, estradiol contributes to leaky gut, even when it's being balanced by progesterone. So you've got to be careful. You don't want to be in a state of estrogen dominance. And if it's behaviorally caused, you definitely want to change your behaviors around that. Let's see here. Lorna says, doctor prescribed Premarin. I got a new doctor. I love that. Way to have the courage, Lorna, to buck the docs. A lot of you got to remember that doctors, they should work with you and they shouldn't be dictators to you, not solely. I mean, certainly you want to try to have the ability to have a good relationship where you can trust their expertise, but at the same time, if your hackles on your back are going up and all things are pointing to run away, then don't get paralyzed and don't stay over the fear that you might offend the doctor or upset the doctor because you're not following their order. Generally, you want to have a doctor who works with you and not against your philosophical beliefs around health. Lauren wants to know, is doing a heavy metal detox dangerous if you still have amalgam fillings? I'd say it's probably not dangerous. It's just not effective. If you still got amalgam fillings, there's no point in doing a massive mercury detox, because every time you chew, you're releasing mercury vapors and you're just being re-exposed. And so it's not something I would recommend without having those fillings removed first. But even beyond that, I would say ask your doctor to check to see if you even have a mercury toxicity. Remember, sometimes there's an old saying, if it's not broke, don't fix it. And just because you have a silver amalgam doesn't necessarily mean that it's decaying and breaking down and poisoning you. You should put it on your schedule too at some point in your life, try to get rid of it. But at the same time, you can do a chelation challenge with something called DMSA, and you can help to detect whether or not mercury is even a problem for you. And that might be something you want to do before you have a bunch of dental work, especially those of you who have, 2, 3, 4 or more silver amalgam fillings, because some dentists get really aggressive and want to remove a bunch of them at the same time, which can also lead to exacerbation and danger. Kath says, what do you recommend for managing hot flashes and considering coming off of HRT? It depends. If you come off of HRT, and if you're doing something like no grain, no pain, that might be all you need. So a lot of times I've seen women who, their grain consumption, their gluten exposure was creating the symptoms around their menopause, like hot flashes and hormonal imbalance. So changing their diet sometimes was enough, and they could come off of their hormone replacement therapies and not have to worry about the exacerbation of hot flashes. So that would be step one, in my opinion, would be lifestyle change first, diet change first. Now beyond that, there are certain botanicals that have been known to be helpful for women struggling with hot flashes as well. There are things like, for example, Vitex agnus castus, which is an herb that helps to kind of, it acts as what's known, it's called an adaptogen. So an adaptogen, meaning if your estrogen is too high, it competes with your estrogen to kind of reduce the estrogen's effect, your own estrogen's effect. If your estrogen's too low, it acts as a mild estrogen, so it helps to bring an estrogenic activity to your body. So that's why it's called an adaptogen, because whether your estrogen's high or low, it kind of helps you adapt more toward the middle, so to speak. So estrogenic adaptogens, Vitex is a good one to start with. Some women also find products like DIM very helpful. DIM is another product that can help you properly metabolize estrogen. But again, before I would go jumping into the whole realm of adaptogens and herbals, just like with what I was talking about earlier with adrenals, I would recommend first doing diet and lifestyle change. Let's see here. Yeah, so Mary Lou says, I just had this Sotapel pellet for bioidentical hormone therapy inserted. I have Hashimoto's and Sjogren's. Is this a bad thing for me? It may be, it may not be. It's hard to say, Mary Lou. First and foremost, I don't like pellets, and one of the reasons why is you can't control the dose. So I say if you've never had a pellet before and then you get a pellet, if the dose is too strong, you could actually create problems, and because that thing takes about 3 months to dissipate, you're now stuck with that pellet. So pellets are not something I generally tend to recommend. I've seen a lot of doctors try to push pellets. I much prefer to see a woman on some type of oral or cream-based estrogen, or any hormone for that matter, because you can control the dose. You can adjust it up or down based on your responses. I would just simply say, if you've got the pellet in, you just make sure you get with your doctor and he's measuring or she's measuring your hormones as you're going through this process to see what that pellet actually is doing biochemically speaking. Let's see. What does it mean when women grow hair on their chin? My friend has that, and we don't know why. Yeah, so hair on the chin is a kind of there's a name for that. It's called hirsutism. But hair on the chin, one of the most common problems with chin hair. So if you're a woman, you've got chin hair, and it's dark chin hair and it's thick. And now I'm not talking about a hair. Occasionally you get a dark hair. That's not what I'm talking about. I'm talking about if you didn't shave, you'd have a problem type chin hair. And this is oftentimes linked to PCOS, polycystic ovarian syndrome. So, again, a cyst on the ovaries will contribute to blood sugar dysregulation, so blood sugar problems, which then subsequently lead to hormone issues that promote improper metabolism of your sex steroids. And so an increased testosterone-like effect can be seen in these women, and it can cause hair growth, a lowering of the voice, those types of symptoms, hair growth on the chin or in other undesired places that would typically not happen for a female. But again, creating almost like male sexual characteristics in a female linked to PCOS. Now, just so you know this, PCOS is autoimmune. It's a form of autoimmune disease, right? And it's also sometimes referred to as diabetes of the ovaries. So if you've got chin hair and you've got a history of PCOS and you're not looking at carbohydrates and blood sugar and why that might be abnormal, then you're missing the boat completely. This is why a lot of women, when they get a diagnosis of PCOS, a lot of times doctors will want to give them, again, estradiol, right? And so estradiol increases the risk of developing leaky gut, which increases autoimmune disease, which PCOS is. So my opinion, it's probably not the smartest move to make. A lot of doctors also, though, too, because this is a form of diabetes on the ovaries, will give a drug called metformin, which helps to sensitize cells to insulin. And so it can help with blood sugar control. But the problem with giving metformin as a drug is metformin causes folate deficiency. Folate is a B vitamin. Any of you ever heard of MTHFR, methyl tetrahydrofolate reductase, or the mutations associated with those? When you take a drug like a metformin and it causes you to lose your folate, and if you have a gene mutation for MTHFR, it can actually exacerbate the problem. And you should also know that estrogen causes folate deficiency as well. Now, I'm not talking about your own natural estrogen. I'm talking about prescription-based medication that you're taking can deplete folate. So again, this is one of the problems with estrogen, giving it, just handing it out haphazardly, which is what a lot of doctors do, at least in my opinion, is they hand it out without cause for concern about the nutritional side effects or consequences. You should know that estrogens cause nutritional deficiency. Again, we're not talking about your own natural estrogen. We're talking about prescription estrogen. So I mentioned earlier B2, B3, B6, folate, vitamin B12. All those things can become more deficient as a result of using estrogen-based drugs. And so again, coming back up here, how do we control blood sugar? One of the biggest ways we control blood sugar is through B vitamins. So if you're taking this drug to control this and you're depleting your B vitamins in the process, you're making your blood sugar worse. And then if you add metformin to that, you're making your B vitamin folate worse, but metformin also causes deficiency of B12 and CoQ10. And CoQ10 deficiency causes mitochondrial dysfunction, which can lower your energy, cause you to start developing muscle pain and aches and neuropathy. And again, we end up in a very bad place. So we don't have time to get into the complete biochemistry of that, but it was a good question. Let's see here. Let's see, Marianne, what about the bioidentical hormones that are compounded to your body? They're not that great for you? Look, I don't think so. It's I have a different opinion probably than a lot of doctors that prescribe hormones. I think if you're a woman considering going on estrogen therapy because of quality of life issues, so like if you are going through menopause or perimenopause and the hot flashes are so severe you can't sleep, and so your sleep quality is so poor you can't function, that might be cause for looking at this. But again, if you haven't changed your diet and your lifestyle first, so estrogen, my point is estrogen therapy shouldn't be the first thought. A diet and lifestyle should be the first thought. If that fails to achieve kind of a normalization, right, then now you can get with your doctor to consider bioidentical estrogen-based therapies. They're not always bad 100% of the time. I mean, there are women that meet the criteria that would be good candidates for that. I think too many doctors, though, are too quick to do it. I just see women come to me, again, all over the world. They come to me and they've been, they went into their doctor didn't even test them. Right? They just said, oh, your symptoms sound like estrogen. we need to just put you on estrogen. And they say, oh, it's bioidentical, so it won't hurt you. And it's like a marketing term. Bioidentical doesn't mean that it's not a powerful drug that won't affect you also in negative ways. And so it becomes a quality of life issue. But again, how do we improve our quality of life? We improve our quality of life through diet, through exercise, through lifestyle. If those things fail, now we have a potential where medicine might be a good choice for you. And again, nobody can make that decision for you. I would just say don't make it in haste, because if people make it in haste or let their doctors make it in haste, that we kind of create this cascade of problems that we don't want to necessarily create. So, and remember, if you do go on an estrogen, it's extremely important that you ask your doctor to monitor your estrogen levels, right? To keep tabs, not just measure. So when they're measuring, there are different ways to measure hormones. If we're talking about estrogen, estradiol, also known as E2, but there's E1 and there's E3. So these are kind of the three primary forms of estrogen. E1 is estrone, E2 is estradiol, and E3 is estriol. Okay, so those should be measured, as well as total estrogen. And a lot of doctors, what they'll measure is, the only thing they'll measure is total estrogen. They won't tease out E1, E2, and E3, so you don't really know what's happening with those subtypes. But there's one other thing that your doctor should probably measure, and that's a compound called SHBG. That stands for sex hormone binding globulin. And the reason why is if your SHBG, if it's too high, it can bind to your estrogen and make it not work as well. And so one of the ways to lower SHBG, if you have a high SHBG, is to exercise. Exercise helps. It's one of the best ways to actually lower sex hormone binding globulin. And if you aren't exercising appropriately and you know it, right, and you're struggling and you've got hormone symptoms, this is why exercise becomes so important, and that's one of its side effects in terms of benefiting you. Let's see here. Does topical estrogen cause the same issue? Clarify for me, Anita, when you say the same issue. If you're talking about the same issue that we're talking about here, yes, it can. Topical estrogen can as well. Remember, your skin's an organ, it absorbs, and that absorption goes from your skin to your bloodstream. Let's see. Hina wants to know, what about phytoestrogens? Are they good for us? Depends. Some of you can benefit from plant-based estrogens. There are different phytoestrogens. Soy is a common source for phytoestrogens. And in some products where we don't want to use, let's say a woman doesn't necessarily want to use prescription drug, so instead she's using different phytoestrogens, plant-based compounds that have estrogenic activity as a substitute for taking a prescription drug estrogen to see if she gets a benefit. That's an option. So phytoestrogens can be okay. It's just, if you're talking about, are you going to take high doses of phytoestrogens in concentrated forms, you still want to treat it, with a degree of well, let's just say caution. Not that they're super dangerous, but again, we don't want to create an imbalance. We don't want to solve an imbalance by creating a new imbalance. And that's the problem in medicine today. Newsflash, for those of you who haven't heard this before, but, medicine is designed to chemically manipulate you by giving you some type of drug, right, that will manipulate your biochemistry so that it changes how you express the symptoms that you're feeling. So like if you go to the doctor and say, I have pain, if you go to the doctor and say, I have breast tenderness, if you go to the doctor and say, I keep getting urinary tract infections, if you go to the doctor and say, I'm having hot flashes, or I'm low on energy, or my libido is no good, usually what happens? They write you a prescription for a chemical. That chemical artificially manipulates your symptoms, but it doesn't fix why your problem existed in the first place. Fundamentally speaking, you should always look for the reason why, not for what to call it and what drug to give it. And it's the same thing with plant medicines. Look, plant medicines are very powerful. Most of our drugs are made from plant medicines. So you have to have a high degree of respect for them, which is why I'm a big fan of testing. I'm a big fan of trying to get to the bottom of the underlying reason as to why the problem exists, as opposed to just medicating it and masking the symptoms, because that gives you a false, what I call pseudo security, like a false security. And it's really, in my opinion, it's pseudo compassion as well, meaning doctors will say, I'm just being compassionate, I want you to feel better. But I would say that's not true compassion. True compassion is truth, right? Truth is compassion, and truth is a hard pill to swallow sometimes, right? Sometimes we don't want to hear the message that we're not exercising enough or that we need to change our diet, right? But as a doctor, it doesn't serve you to lie to you. It doesn't serve to come at you with pseudo-compassion and manipulate your chemistry so you feel better without telling you why you don't feel bad in the first place. It serves to enslave you. And I say enslave, meaning it enslaves you. It makes you a slave to needing that medicine for the rest of your life to appease your symptoms. And to me, that doesn't cut it. That doesn't cut the mustard. It's not a good approach. It just leads to dependency on drugs for the rest of your life. Sharon wants to know, can autoimmunity also result in rashes? Sure it can. There's eczema, there's psoriatic arthritis, there's hives, there's a number of different skin manifestations of autoimmune disease that can occur. And so, yeah, absolutely, it can manifest as rashes. Do you get an increase in leaky gut even when the estrogen is bioidentical? Yes, Marie. You have to remember that even though it's bioidentical, you're taking it in doses that is not what your body would typically produce, possibly. And so you're getting these spurt doses that you're using if you're using a drug. Estrogen has that effect. Again, remember what I said earlier. Autoimmune disease affects women more than men. Okay, and one of the big reasons why is estrogen. And one of the big reasons why estrogen, because estrogen can contribute to leaky gut, and women are more prone to estrogen dominance problems because of our modern environments. So yes, even bioidentical hormones can increase the risk for developing these very same issues. So don't fall into the blind spot of just because it's bioidentical, it's somehow better and it doesn't have side effects. Remember, always respect any drug, whether it's bioidentical or whether it's not. Let's see, can hormone imbalances cause a 30-pound increase in a 2-month period? Yeah, absolutely. Hormone imbalances and hormone changes are notorious for creating weight problems, Kathy. And I would say, especially if you're under a lot of stress in this last few months, with the virus, with the riots and everything else that's going on, a lot of people are under a lot of tremendous stress. And so their cortisol levels are being driven up, and cortisol causes you to have blood sugar excess, which, when your blood sugar goes up in your bloodstream, what that does is it makes everything sticky. Your heart has to work harder. But in addition to that, that blood sugar elevation is going to increase the triglyceride production. Your body takes excessive glucose and turns it into fat and then stores that fat as kind of conserved energy, right? And so you can gain a lot of weight in that way, but you can also gain a lot of weight with cortisol increase and stress as a result of water retention, because your adrenal glands also regulate your water balance. Let's see. Yeah, Loretta says, I was diagnosed or prescribed estrogen for osteoporosis. Do you think it's a good reason to take an estrogen progesterone supplement? Look, I think that's a question that probably is better answered with your doctor who has a really deep history on who you are and what's going on, what other cofactors or lifestyle variables are going on within your life. That being said, me personally, I have seen lots of women who have been on estrogen for bone loss but didn't really need it. So is that a wrong approach that you're taking right now? I don't know. I just don't have enough information to really give you an intelligent answer that wouldn't potentially create a problem for you. Let's see here. Is it possible to bind xenoestrogens and remove them from the body? It is. And the way we do that is with things like DIM. So DIM is going to help metabolize those out, but so too are the B vitamins. It's very important to have adequate magnesium and folate and B12 to properly metabolize estrogens, including xenoestrogens, out of the body. It's also very critical that your glutathione systems in your liver are functioning really well. And glutathione, some people are glutathione deficit, and there are a couple of different amino acids that play a role in producing glutathione, glutamine, and cysteine being two primary ones that I see people being deficient in quite a bit. But yes, it is possible to do that. Okay, so if you have no ovaries, should you be on bioidentical hormones? If you don't have any ovaries at all, this would be one of those things where you work with your doctor, you test, and you come to that decision as that doctor's being investigative, like helping you work with your diet, helping you work with your nutrition, but also testing to see, is that effective enough, or do you need additional additional support through medication. Okay. What causes uterine fibroids and how to shrink them to prevent heavy bleeding? In my experience, GN, probably one of the best things that you can do if you're struggling with a uterine fibroid issue is right here. I've seen a number of cases where women went on no grain, no pain diet, and their fibroids also went away with that diet change. So if you're not there in that place of diet, that's the number one thing I could tell you to make an attempt at doing first. And then maybe come back in a few weeks after you're on the diet, and if things aren't getting better, then you could kind of re-ask that question. We're here every Monday at 6 p.m. Okay, I think we've got more questions, but we got no time. So look, I hope this was extremely helpful for you. I know it's a topic that very few doctors are going to breach or even attempt to attack or attempt to communicate about, because so many women are put on that estrogen therapy. So again, if you know somebody who might benefit from this, hit that share button, copy that URL above and paste and send it to them, text it to them, email it to them, and let's get them the help that they need. Remember, the goal here is we're trying to save 100 million lives. As I said earlier, I'm going to put the links below to those research studies. So if you are having a follow-up conversation with your doc and you want to have some valid studies you can print out and take in and kind of facilitate that conversation, we'll put that in the comments section in the description below the video here. Until next week, hope you guys have a fantastic week, and we'll see you next Monday night, same time. Take care. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.